Welcome, everyone, to Cleft Palate Craniofacial Journal's podcast, which is now podcast and video. And I'm really excited to have this group of guys that I know. One of them I know for a long time, who's one of my old fellows, who complimented me by saying I haven't changed. Thank you. I love you, Raj. I'm Pat Chibbaro. I am the multimedia specialist, the podcast editor, and I'm really excited when I saw that this paper was accepted. I don't see it yet online first or in the actual journal, but be on the lookout. It's Cleft Summit 2022, the impact of a unified voice. And I'm going to ask Usama Hamdan. I have Usama Hamdan, Wassim Najjar, and Raj Vyas, who are among how many authors are there, Wassim? You said there were 5?
There are 5 main authors, yes. However, there was a Cleft Summit 2022 consortium that included close to between 15 and 20 participants that were within this Cleft Summit. There were 32 actually global leaders within this impact voice.
So let me ask you, which is what I always love to know, and Usama, maybe you can talk to what motivated you to pursue this.
Hi, Pat, and thanks for having me again. As you can imagine, basically, the cleft community, unfortunately, in many parts of the world has been quite fragmented. And as I always keep kind of talking about it, with all the craziness that's happening in the world, the cleft is like a drop in the bucket compared to famine, disaster, wars, and stuff like that. As long as we continue to be fragmented, no one is going to listen to us. And this is the hope, basically, was behind trying to bring the cleft community together to have a unified voice. And this actually started with the idea of the comprehensive cleft care workshop. We're into our 7th international one, lined up for Cartagena for 2025. So, and I'm looking forward to having you joining us as well as a speaker and faculty. So basically in 2022, during Rio de Janeiro, he said, how about actually if we can have a Cleft Summit similar to the Davos Economic Summit that takes place every year in Davos, where the economic powers basically sit there for 1 week or so under one roof. It happens actually that the CCCW has been able to bring in all these amazing talents, actually almost 70, 75 world leaders under one roof. This is the only meeting that I know that is able to bring these world powers. And I said, let's see if we can tackle maybe some issues that are of importance and pertinence to our topic. And that was actually the idea behind launching the Cleft Summit in 2022, which I asked actually my dear friend Raj and Joe Losi to take charge of this. And we wanted initially to tackle something that was kind of non-controversial, because everybody has their own ideas, everybody has their own thing. And we thought we tackle one specific thing. And then I was happy, actually, based on that in 2023 in Barcelona, we were able to step back and look at the big picture and tackle something that is, I think, of more importance, which I will talk about it after Raj fills us in on what happened actually during the first Cleft Summit.
Yeah, so let's jump in there, Raj, maybe, and give us an overview of this paper and what you guys did.
Yeah, thank you, Pat, and good to see everybody. Usama, it was a nice honor to be given this task to organize both the CCCW that year, but specifically also with Dr. Losi, but also specifically with him also to focus on this Cleft Summit, the first thing of its kind, that we would really take this great group of multidisciplinary, interdisciplinary, talented people and ask them a question to think about before they would get there, so they would have some time to reflect and to ponder on it, and then go through this iterative process to kind of see how we could potentially answer that with a unified voice. And that was really the fun part of it and the challenge of it, for sure. So Dr. Losi and I think we met at one of the international meetings, and we sat down for like an afternoon and had some coffee and talked about various things that we could all talk about. And the previous CCCWs, one of the things one of the themes that kept emerging from a lot of the lectures and a lot of the controversy we were seeing was around VPI, velopharyngeal insufficiency, and how we treat it. And we could see that the algorithms were clearly shifting from doing procedures that were kind of obstructive towards breathing, like a pharyngeal flap or sphincter pharyngoplasty, narrowing the nasopharyngeal airway, to things that were more dynamic, like lengthening the palate. And there are so many different ways to lengthen a palate. You can add tissue, you can rearrange tissue, different types of tissues, fat, flaps, etc. And everyone seemed to have their perspective on it, and the data was sort of promising, but not conclusive in some ways, and so, but these were a bunch of the talks coming out of CCCWs. I myself changed my entire practice from having attended the CCCWs and started incorporating buccal flaps and buccal fat flaps and for these problems, and I could see the results there immediately in my patient population for both primary palates and for VPI. And so when we sat down to talk, Dr. Losi and I, we thought this is definitely an important question that we should focus on, and maybe one that we can hopefully find some consensus on, because we could see the trends moving in that direction. And so we asked everybody before they got to the summit, we sent them an email, all 32 global cleft leaders in this space, surgery and speech and orthodontistry and nursing and anesthesia, psychosocial. We had representatives from across the spectrum. How can we improve the interdisciplinary evaluation and management of velopharyngeal insufficiency? And to think about that from an algorithmic approach, as well as from specific treatments. And so then when we got together in 2022, we reserved one evening for this group of people, a 2-hour process, and all the participants engaged in this sort of face-to-face dynamic exchange of ideas and evidence. And we sat there and we collaboratively refined and integrated insights through this very deliberative process. And so we put up a statement in the beginning. We tried to look at what the variables are that we would put together to test a hypothesis, what this hypothesis would look like. And there was a lot of sort of back and forth, a lot of controversy. But ultimately, there was much more consensus than there was controversy. And that was exciting to see.
Did you expect that? Did you expect that? Just Raj, I've been in this, I was in this field for 34 years. I know so many of the surgeons, so many of the specialists, and I'm thinking in 2 hours with that big question, it must have been, I'm just trying, I wish I could have been in the room. I'm thinking, what was it like, and I'm thinking, the first thing I was thinking was 2 hours enough? And I bet it continued outside of the 2 hours.
For sure.
At the bar afterwards.
You're absolutely right. Like, we were worried about the exact same things, and I guess our goal was to see how far we could get. And I would say for the first hour and a half, it didn't seem like it was going to come together. And what I'm learning about these summits and what we saw in 2023 is that's sort of what it takes. Like, there's a lot of just everybody wants to get their thoughts out. There's thoughtful deliberation, but as long as there's a commitment to finding a common ground, there can be rigorous debate. But ultimately, as the clock starts to tick down, I think Dr. Losi and I tried to refocus. Okay, we actually are disagreeing about a few things here, but we're actually really, really agreeing about a lot of things. So let's try to consolidate what those agreements are, and try to put that forward as a work product of this group. And so. So yeah, I think it would have been fun to be a fly in that room. Pat would, I'm sure, especially with your experience and insight, it would have been great to have you there. But what we eventually came up with was, okay, well, we're not going to agree on everything, but let's agree on some stuff. And we said the statement, and it's outlined in the paper, is that when a child has significant VPI, and significant is something that we can define, and the velum is dynamic, and dynamic is something we can define, then the first surgical procedure should seek to lengthen the velum, and lengthening, again, is something we can define, and that's something as opposed to narrowing the nasopharyngeal airway. And the purpose of that is to optimize the patient's outcome. And optimizing a patient's outcome, again, is something we can define, right? But if we leave significant, dynamic, lengthen, and optimize as things that we can dive deeper into, then we all agreed on that statement, and that was an important first point, I think. And one of the cool things, and I'll stop with this statement, is just that like we couldn't figure it all out here, and we understood that this was just a hypothesis, but it was an informed hypothesis amongst people who are really sort of experts in this area. And so the next part was about testing this hypothesis. So defining what these variables really mean. What's significant PPI? What's a dynamic BLM? What are the options for lengthening? And we created little task groups to look into each of these things, and then put together the backbones of a multi-center prospective study, because ultimately this is a hypothesis that needs to be validated.
So after those 2 hours, then you then left the summit with more work to do as a group. Wassim, maybe jump in on that about, what happened after those 2 hours.
Well, definitely after those 2 hours, I mean, as Dr. Raj said it very properly, it was how we're going to take this statement that we just had, defined, this unified voice. How are we going to make it into, like, how are we going to test this hypothesis? And that's where they realized that a global multi-center prospective study might be the best way to go. And getting whether it was an ERB approval from the institution as a whole, or collecting it in one place with gathering we mainly said that children above the age of 5 with non-syndromic cleft palates and no other diagnosed anomaly who underwent a palatoplasty and are planning to undergo velar lengthening to treat VPI, those are basically with the patients that we're going to include in this study. And how are we going to realize these outcomes as they go? And then we kind of realized that we might be beneficial to exclude any child who has previously received any buccal flap or any myomucosal flap or any kind of flap as a whole. And each person goes back, or each physician goes back to his or her institution and see how are they going to contribute to this multi-center approach, and how are we going to make this, hypothesis valid.
Sorry, I was on mute. So now, I mean, I'm just thinking, this is so huge what you have done, and I think it's awesome. I wonder, as the nurse practitioner in me, what did nursing bring to this? What were their thoughts, or are you able to, think about or remember what the different specialties brought to the table? Because I'm trying to think, if I were there, what would I have contributed?
Yeah, I mean, so nursing became a huge part of the CCCW in our last, the last CCCW, which was in Barcelona. That was actually the focus of the conference in terms of like the sort of additional track that was added. Unfortunately, it wasn't as well represented in our Rio group. So nursing had a huge role in Cleft Summit 2023. Usama, do you have any thoughts on if we had a member of this group in 2022 who was specifically from nursing? My thought is that I don't remember if that was present.
So you had ortho, speech, surgery.
We had a psychiatry as well.
So you had psych. Psych. Yeah.
Yeah, I mean, we added actually. The first workshop, Pat, actually in 2018 had nursing, and unfortunately there wasn't much reception or attendance at that time, so that was dropped, and it became very apparent actually as the scope of CCCW increased that there's no way we can not add nursing into the multi-specialty. And it was just amazing just to see nursing in Barcelona interacting with SLP, with speech, with the surgeons. I actually had one surgeon actually whose nurse was there. She said, I didn't even know that nursing did all the stuff, So I mean it was just, so and many actually of the surgeons as well, left the summit as well as left the workshop saying, I've learned so much, I'm going to be changing even the way I approach things. And that's the power actually of A, collaboration, B, sitting together under one roof and listening to each other rather than, putting the blinders and
Absolutely.
forward.
So to answer your question, Pat, sorry. Yeah. Just to answer your question though, like in terms of like what I think we could have benefited from if we had that perspective,
Yeah.
You know, specifically things like feeding and breathing, I think would have been really important because, you know, doing a pharyngeal flap has some morbidity with those aspects as well. Whereas, you know, those are the things that we were looking to mitigate, and to have that input and perspective on
Yeah,
people who
definitely.
really are taking a deep dive into that on a daily basis with the patients would have been really
Yeah.
nice.
What I was thinking, you know, because I've seen the changes in management over the years, is, you know, you mentioned buccal flaps and changing your practice, and I, you know, when, you know, just for myself as the nurse practitioner on the team, getting used to buccal flaps, then teaching parents about it, because it's a great procedure. But one of the things that I found post-op was that the recovery was more difficult for the kids in terms of feeding, and I think just having the big picture of, you know, when you're trying to make recommendations, and factoring in all of it, you know, I'm so glad
sure.
to see, yeah, that you're getting the input from all sides. I think it's just the way to go, and I just love the idea of putting that question out, that big question where you knew you were going to get a lot of controversy coming in, because there's so much opinion about what and when, and, you know, everybody has their own numbers and their own data and what's the best. You did a monumental thing, which I think it sounds like, were you surprised at, you know, at the outcome of it? Were you, you know, I'm just wondering, you know, when you went into it, you must have thought it was going, you know, you knew what, you know, what it was going to be like, you know, and again, I wish I could have been in the room, because it just sounds like the amazing amount of energy based on the idea that everybody wants to do what's best for the patient, but people having specific feelings about what they think is best for the patient based on their own clinical practice. I just think it's, you know, it's a great thing to do, but I wonder, you know, what the outcome was, in, you know, or what was there anything that was surprising to you? So any of you can jump in on that question. Were you surprised by any of it?
I think like what, you know, what was most sort of, I don't know if surprising is the right word, but enlightening was to see that like that people had, like, for example, let's talk about like, you know, the specific lengthening of a palate, right? Like you know, it's not all buccal flaps, right? Sometimes it was like, you know, a furlough,
Right.
sometimes it was a furlough with the buccal flap, sometimes it was like a revision, pushback, and, you know, just rearrangement. Sometimes people were adding like acellular dermal matrices, sometimes people were adding fat. Like there were so many different ways to do it.
Yeah.
But and we got, you know, I think we went deep into those nuances, and I think we left that as, and that's what we came out of this thinking, like, okay, like we all agree that this is on the whole a better approach, like to at least try this first in the patients in which we can identify as good possible candidates for this. You know, they have a dynamic velum, etc. They haven't had the things that exclude them, like Wassim was talking about. But like, no one institution is going to be able to like answer this big question, because we all do this differently. But that's why let's bring us all together, and evaluate it as a group, and we can compare outcomes. And we set those metrics. So we said, like, you know, from like, let's get a validated patient reported outcome measure. Let's get a, you know, that's language specific to the country. Let's get you know, so like what might be like the Pittsburgh weighted scale for something objective here might be something else somewhere else based on language or whatnot. But we need a you know, objective. We need voice recordings. We need and there was a lot of debate on like how to define like severity of EPI. Some people were like, you either have it or you don't, or it's mild, moderate, severe. But some people were like, that doesn't make sense, and that part got pretty heated. And you know, and then, you know, like nasometry and sleep studies, for example. You know, some centers have MRI. Like,
I was
so
just going to say, MRI seems to now be the thing, you know,
right
and that is just something that I never really was, just never, you know,
on the
on my
radar,
radar.
yeah. And you know, so we, for example, our institution now, we've incorporated MRI with Dr. Perry's help, and so we, you know, there are various things, but we also wanted to be able to study this in a low resource setting. So like, you know, when outreach groups go, and we wanted them to be able to apply this algorithm so that they are doing state of the art care for patients
Right.
as well. and they may not have like, access to like a sleep study or this, but we said, let's like, instead of debating like exactly what metrics we're going to use, let's agree that these are all metrics that can be used, and whatever you have available to use in your setting, record that prospectively, and like we'll come back and we'll sort through it at some point, and figure out what data there is from where, and how it fits together. So if you don't have MRI or sleep studies, but you have like a speech assessment tool or nasometry, then use what you have, and let's like evaluate outcomes that way. And then we can start to actually get a little bit more nuanced about these like 4 words that I mentioned earlier that that are going to require a little bit more in-depth evaluation.
So what's the update? This was Cleft Summit 2022. What do we see next? I know this, we'll be seeing this published. What do you, I know obviously there's been, Summit 2023. What's next?
I'll just say in Summit 2022, in Summit 2023, we did reevaluate. A lot of the same participants were there, so we gave them an update on this, and we went a little bit further in terms of defining the study. But then we introduced a whole new topic in 2023. I don't know if Usama or Wassim, one of you guys wants to talk about that.
Thank you so much, actually, Raj. So what we did basically is, based on the success of the 2022, we wanted, as I mentioned, to step back and look at the big picture. At the end of the day, prevention, as we say, an ounce of prevention is better than a ton of treatment. So what are the issues that are basically that we can impact us as on the global level? And this is why Global Smile Foundation is right now trying to work with the authorities in the various countries that we work with. Folic acid, oral health, and avoiding exposure to smoking during pregnancy. These are 3 simple and effective tools that can impact the life of millions of patients all around, minimize the billions of dollars spent on potentially unnecessary care. And if you can just think about it, basically, we're talking actually to various authorities right now throughout the areas that we're in, by trying to convince them to add folic acid to bread, which on few cents on the dollar basically can avoid the potential of spina bifida, cleft palate, avoiding exposure to smoking, which increases the incidence of cleft lip by 26%, the oral health that increases the heart disease and death at a younger age because of the heart inflammation, all these things that the public is not really aware of, and we can really kind of make an impact. So we discussed all these issues, and I believe that we ended up actually agreeing that these are things that should be the focus of our second Cleft Summit. And Wassim, maybe, or Raj as well, if you'd like to elaborate a bit more on this.
Wassim, any other thoughts?
I would let Dr. Raj expand a bit more on this. He was more intertwined with the second one. I was more of a fly in the room, as they say.
Well, it's all the things that Usama talked about, but we also were asking, what is the role of the NGO in helping implement these changes to policies, or how we can, what is the role of NGO in terms of like, and what came out of it was really health system strengthening. Like what we do, like Usama mentioned, is just cleft. By the time we're talking about treating a child with cleft lip and palate, we're really at the end of the spectrum of specialized tertiary care for a region. Like that may not be a priority for them if things like diarrhea or malnutrition or things like that are rampant. And so, but if we want to, and I think Ruben Ayala from OpSmile and some of the other people really made this point really nicely, who participated in the summit, was, all of us should be focused on like, okay, we're getting a patient from somewhere rural in a mountain to a center to get cleft care, ideally in a team-based comprehensive setting like Global Smile Foundation has really, established as the criteria and norm for good care. And as we do that, like, let's take what we're doing and work with the ministries of health to make that a part of how we strengthen the entire health system. So we're not just doing it for this cleft population, but we're doing it for patients who need every type of healthcare service, and the synergies there and how we can work together. And so, we're focused on this one very specific problem, but if we can solve it for a few patients, that model can be extrapolated for many, many more. And obviously it requires so much partnership and synergy. Like whenever I'm anywhere overseas with Usama, I see a master at work that are doing, creating those partnerships, and it's a beautiful thing to see and watch and learn from. But those things are critical, and again, guys like Ruben Ayala, who are just also excellent at that work, and so they had a lot of great perspectives on it. And I think everyone in that room had participated or has participated in NGO work that addresses sort of short-term needs around the world, as and I think everyone believes that short-term needs are not the solution to finding long-term solutions, but you can't ignore the short-term needs because that's real patients now. And so what is the role of the NGO in terms of trying to take our short-term missions but make them a part of a bigger term solution?
Well, I'm just, I really am so, in awe of the work that you guys have all done, and just getting teams from all over together on, to really look at these important questions. I just think you've done a great job. And I want to, before I summarize, wanted to know if there are any last thoughts from any of you, anything that our listeners and viewers might want to know, either about your paper, about other future work that you're doing. Last thoughts.
Thank you, Pat. Actually, I would certainly encourage everyone to try to join us in Cartagena, November 18 to 21, 2025. Other than being an amazing city of Cartagena, we have so far at least 65 international faculty actually who've accepted to join. We have also, other than 3.5 days of intensive working, including nursing, speech, psychosocial, dental, ortho, surgery with new models and this and that. We are also adding anesthesia as another component as well, and difficult airway, which I'm excited about. But the key point basically is that will be the third Cleft Summit for us. And I was seriously hoping that we can have an agenda that can address, again, not only a certain aspect of patient management, but again, the global needs for cleft care, and how can we, as a unified voice, based on the article title, how can we bring this change forward? And again, I'm grateful for Raj and Joe and everybody involved, and I'm also grateful to my dear friend Ruben Ayala as well for having also been guiding us, through his work in the governance area.
Well, I definitely encourage everyone who's listening and watching to be on the lookout for this amazing, just a little illustration of the work that you've done in this paper, which is Cleft Summit 2022, The Impact of a Unified Voice. I don't have all the authors in front of me, but I know that I have 3 in front of me: Usama Hamdan, Raj Vyas, Wassim Najjar. Wassim, also you have, it's Joe Losi and Kummer, and how many other authors?
Yes, we have Dr. Kummer, Dr. Losi. If you want, I can run through them briefly, but it's we're close to 20 other authors that were collectively grouped into the Cleft Summit 2022 consortium, all of which
I think it's a total of 32 authors.
Amazing.
Yes.
Amazing. But Raj, just the just getting the different disciplines together to really listen to each other and really try to come up with with a unified, as you said in the title, a unified voice, and to help our patients. And I'm really excited. I can't wait to see this come out. I can't wait to see you all. I hope you'll all be. Wassim, will you be at the meeting?
Hopefully.
In Denver? All right. Well, that's where I went. I went to grad school in Colorado. That's where I became a nurse practitioner. And so it's my second favorite place besides New York. And so I look forward to seeing you all there. And And I will be making sure that everyone at the meeting, I will be saying, just be on the lookout. Cleft Summit 2022. Look for that paper because it's a great one. So thank you so much for joining me, and I look forward to seeing you at the meeting in about a week. My goodness. So thanks very much. Thank you, Raj, Wassim, Usama.
Thank you, Pat, for the honor, and looking forward to seeing everyone hopefully soon.
Terrific. Take care.
Thank you,
Bye-bye.
Pat. Thank you very much. Bye-bye.